Now we are looking at some other category or classification of nerve diseases. Okay, so trying to define terminology here. When you see something is metabolic, you are trying to talk about all those electrolytes in the body. When you see something is nutritional, you are trying to talk about the food we eat. Okay, so electrolytes in the body can cause injuries to the nerves. Nutrition, the food you eat, can also cause injuries to the nerves. And once you are saying peripheral nerves, you are trying to talk about all the nerves that are outside the central nervous system. They are on the periphery. So of course these are not single disease conditions. You are just trying to, like it's a classification. So you are trying to look at all other disease conditions that fall under this classification. So all those pictures were those examples. So they're actually nerve disorders caused by systemic metabolic conditions, or maybe you have deficiencies in some food. You're not eating, some foods properly and all of that. So they often present with a distal symmetric polyneuropathy. Okay, so it affects your sensation, affects your motor, sometimes your autonomic functions. So based on metabolic stuffs. Okay, so I'll just be talking about the condition and talking about the mechanism, how the condition can cause damages to nerves. So you can have diabetes mellitus, and diabetes mellitus will cause issues to nerves because there's too much sugar in the body. So too much sugar in the body will deposit in blood vessels, reduce the blood supply, and this will affect the nerves. Uremia, okay, so chronic kidney disease, your kidneys not being able to sieve out toxins again, so this can lead to build up of toxins. Okay, so uremia, you had issues with your kidneys, so your kidneys are not putting out toxins out of the body, so you're having accumulation of toxins. This can lead to nerve issues. Hypothyroidism, okay, the thyroid hormone levels are low, so metabolism and all of that. Liver failure, amyloidosis, then porphyria. All of this could actually cause issues in the nerves. Then moving up next, okay, for nutritional issues. So for these ones, okay, I think this was what? Uremia, okay. Thyroid hormone levels are low. So this one is all those deficiencies now. So deficiencies, you can have vitamin B1 deficiency. I'll talk about the deficiency and the cause. Pause and look at the symptoms because we are studying together. Vitamin B6 deficiency, vitamin B12 deficiency, vitamin E deficiency, then copper deficiency. Okay, so vitamin B6 deficiency, okay, vitamin B1 deficiency, vitamin B12 deficiency. So in general, the symptoms you have, okay, if you want to pick up the diagnosis, you have to test for all those metabolic stuffs and the vitamins. You still do tests to see how the nerves and muscles are communicating. Then you pick up clinical histories and all of that. So treatment, you try to treat the underlying thing causing the issue. Nutritional supplementation, pain management, okay, physical therapies because you want to maintain the functions and all have you.